Hi, I'm Candy Anderson. I'm a faculty with Hines Community College, and I'm demonstrating the method in which you need to video your skills evaluations, in particular with IV skills. I'm going to start off with the MAR. This is my nurse's station, and then I'll move to the bedside in just a moment. First of all, I want to check my MAR against my doctor's orders to be sure that I have what the doctor has ordered for this client. The 5 or 7 rights still apply here, so we want to follow these steps with every IV skill that you have. So you want to begin with checking the client's name, make sure you have the correct medication, the right dose, the right route, of course the right time, the date of the order should be the same, and then assess for allergies. Report any inconsistencies that you find to your charge nurse, or in this case it would be your instructor in clinical. Wash your hands, and when I go to the client's room, when I'm at the bedside, I want to identify at that time. At this step, I've completed with my physician's order, so I'm going to put that aside. So I just have my MAR here. I would, at this point, perform any contingencies prior to giving the medication and assess for the correct rate of administration when I obtain my dose. So I have my correct medication, and I have a syringe with a blunt needle. I'm going to uncap my vial here. This was a brand new vial, so I don't necessarily have to swab, but if it's not new, I want to swab the top of the vial. Just like your steps in your IM and sub-Q, we're going to obtain our medication, and I need 3 milliliters of this correct medication. So I'm going to inject the air and withdraw 3 milliliters of my medication. And at this time, I want to go ahead and label this medication with the patient's name and the medication name on here. And for demonstration purposes, I do not have caps on my syringes, you'll see, but in the hospital or in your checkoff, you need to make sure that you have a cap on the end of your syringe at all times, because we want to keep that part sterile. All right, so I have my my correct medication. I already had one pre-filled here, so I'm going to use this one that I have pre-labeled. And then I also have my flush. I'm going to demonstrate first our IV push through the INT. So at this point, I'm going to go to my patient's room. I'm going to take my MAR with me. Good morning. I'm Candy Anderson. I'm your nurse today. I have some IV push medications that I'm going to give you that the doctor has ordered. Could you state your name and birthday for me, please? And I'm going to verify that I have the correct patient. I'm also going to check the our ID band and make sure this is the correct patient with the correct birth date. So I have the correct patient. Now also, at this point, I'm going to put this hand up here so that you can see what I'm doing. I want to assess my IV site to be sure that there are no complications, and there are none. I'm going to swab the port. I still have this clamped. I'm going to take off my cap. This is my flush. I actually have 6 milliliters of flush in this syringe. You can use 2 3 milliliter syringes, or you can use a 6 milliliter syringe and flush with 3 each time. And that's what I'm going to do here. So I've swabbed my port. I'm going to attach my syringe. I'm going to release the clamp, and I'm going to a slow, steady flush with 3 milliliters of flush. I'm going to clamp again, remove my syringe, and at this time I'm going to push my medication at the correct rate of administration as identified in my drug handbook. You need to state ahead of time what your rate of administration is going to be, and I'm going to administer 1.5 milliliters over 1 minute. I have my watch, and I'm going to push at that same rate, observing my plunger with the measurements on my syringe. And for purposes of video, I'm going to time-lapse this and say that our rate of administration, our medication, is complete at the end of our time. Clamp my INT tube in there, or my pigtail. apply my flush one more time, unclamp, and I want to flush at the same rate that I pushed my medication. So that should be a minute and a half, I'm sorry, a milliliter and a half over 1 minute. And we're going to be time-lapse again. I want to clamp my pigtail or extension set and then remove my syringe. These syringes will need to go into the sharps container, and I have one behind me here. Drop your syringes in your sharps container, and then of course wash your hands and then document.